India builds a lot. India produces a lot. India spends a lot. And yet, many outcomes remain weaker than expected. This is not a matter of opinion. It shows up clearly in government surveys and international databases. Economists describe this as a problem of inputs not converting into outcomes. The question is not whether India is trying hard enough. The question is why effort does not reliably turn into results. To understand this, we need to look at inputs and outcomes together using real numbers. Let's begin with health. According to data from the World Bank, India's public spending on health has stayed around 2 to 2.3% of GDP. The global average is close to 6%, and China spends about 5%. That already puts pressure on the system. But here is the part most people miss. Data from India's National Medical Commission shows that the country produces over 1 lakh medical graduates every year. Medical colleges have expanded rapidly. Seats have increased. Yet, if you look at the rural health statistics published by the Ministry of Health, many states still fall below the World Health Organization's benchmark of 1 doctor per 1,000 people in public facilities. So the issue is not simply a lack of trained doctors. The issue is that the system struggles to absorb, retain, and deploy the doctors it already produces. Public finance researchers call this a state capacity problem, the ability of institutions to turn resources into services. Now look at nutrition. According to the Food and Agriculture Organization of the United Nations, India is one of the largest producers of food grains in the world. Food procurement and buffer stocks operate at massive scale. Yet, India's own National Family Health Survey shows that about 1 in 3 Indian children under age 5 is stunted. That number comes from India's own official household survey. This tells us something important. Hunger here is not only about food availability. As the World Bank and UNICEF point out, child nutrition depends on sanitation, maternal health, early childhood care, and local delivery systems. Food production is an input. Nutrition is the outcome. The gap between the two lies in how well systems work on the ground. Now consider infrastructure. According to the Ministry of Road Transport and Highways, India has added highways at record pace over the last decade. At the same time, reports from the World Bank and NITI Aayog show that logistics costs in India remain around 13 to 14% of GDP. In more efficient economies, including China, those costs are closer to 8 to 9%. That difference matters. Higher logistics costs quietly raise prices across the economy from food to manufactured goods to exports. Infrastructure experts explain why this happens. As outlined in several infrastructure studies, outcomes depend not just on building roads, but on how well networks are connected, maintained, regulated, and used. Roads are inputs. Logistics efficiency is the outcome. Now let's look at cities. Data from the Ministry of Housing and Urban Affairs and the Central Pollution Control Board shows that many Indian cities still provide intermittent water supply, treat only part of their sewage, and struggle with solid waste processing. At the same time, cities have invested heavily in dashboards, command centers, and monitoring platforms. Our governments tend to focus on what is easy to measure and control, even when it does not fully reflect reality. Digitisation improves visibility. It does not automatically improve capacity. Across public administration research, this tendency is known as instrument substitution, using tools that are available and visible instead of tools that address the real bottleneck. This idea appears repeatedly in OECD governance studies and World Bank reports on state capability. Digital platforms are attractive because they are faster, cheaper upfront, and easier to show as progress. Building real capacity is harder. It takes time, it costs money, it requires institutional strength, so systems often end up managing scarcity rather than removing it. This is not about bad intentions. It is about incentives. Development economists draw a clear distinction between state activity and state capacity. State activity is what we see: schemes, platforms, dashboards. State capacity is harder, the ability to deliver outcomes again and again. This distinction is central to the World Bank's World Development Report on governance. India often does well on activity. It struggles more on capacity. That explains a familiar pattern. Effort increases, programs multiply, technology spreads, but outcomes improve slowly. This also explains why digital reforms often disappoint. According to the World Bank's Digital Development Framework, digital tools are excellent at coordination and optimization. But they cannot create hospital beds, train staff, water, land, or energy. Digital systems work best when there is surplus to manage. They struggle when there is scarcity to hide. When applied too early, they improve reporting, not reality. So what actually works? Comparative development research, including the Hausman-Roderick Growth Diagnostics Framework, shows a consistent lesson. Countries that improve outcomes identify the main bottleneck, invest patiently in expanding it, and then use digital systems to scale efficiency. The order matters. Digitization after capacity creation multiplies results. Digitization without capacity creation rearranges limitations. This changes how progress should be judged. Instead of asking, did we launch a scheme, or did we build a platform? The more useful question is, did we expand real capacity where it was missing? Until that question is answered honestly, inputs will keep rising faster than outcomes. That is not a moral failure. It is a systems problem. And systems change only when capacity, incentives, and institutions move together. India's challenge is not lack of effort. It is the difficulty of turning effort into outcomes at scale. Once you understand that difference, many persistent problems stop looking confusing and start looking structural. Thank you for watching. Please like, share, and subscribe.